I want to get to the vaccine distribution in a moment, but just shorter term, walk me through the calculus on the mask mandate and any news about how hospitals are managing the new caseloads.
Well, there's no doubt that we are taking a different approach than most of my colleagues around the country. There are statewide mask mandates in approximately 40 states around the country. But my opinion is that our goal should not be to just focus on those three words, but to focus on what can we do as leaders to ensure that the majority and quite frankly, as many as possible are actually wearing masks in public. And so we've taken a county by county approach, and we have a very objective criteria. If you as a county have more than 200 cases over a 2-week period, or more than 500 cases per 100,000 residents, then you automatically have additional restrictions put on you, which includes a mask mandate, but it also limits the size of crowds in those individual counties. And we are seeing rising cases here, not to the extent that you're seeing in many other places around the country, but because of that, we added 19 additional counties. And today I have exactly 41 out of 82 of my counties that have those additional restrictions in place. And we think it's going to help us slow the spread.
And meantime, are hospitals having to defer elective surgeries, bring in staff from other states where they can, anything like that?
Well, we definitely have challenges within our healthcare system. There's no question about that. And in fact, in our state, we're a very rural state. And so many of our hospitals actually have ICU bed capacity issues, even in years when there is not COVID. To give you an idea, at our peak of total number of COVID cases back in early August, we had 337 patients in ICU beds with COVID confirmed. Today, we have about 210 cases. So we're at about 65 to 70% of our capacity. Do they have challenges? Absolutely. But you mentioned something that I think is important. When you talk about bringing in staff from other states, that's exceptionally challenging right now because unlike the initial surge in New York City and the Northeast in March and April, and unlike the surge in the Sun Belt in the South, what we're seeing today is there's a pretty significant surge in virtually every state around the nation. And so it limits your ability to bring in staff from other states, which then, of course, puts even more challenges on the hospital system.
Governor Reeves, I just want to go back to I want to go back to your mask mandate. And I just wonder if it's somewhat backward looking. If you mandate masks only in areas once they've reached a certain threshold, wouldn't that be too late? Why not make it mandatory statewide since we know that works and we know that it's preventative?
Well, we certainly know that if you wear a mask, that it is certainly helpful. It helps protect yourself, and it also, the data shows, it helps protect those around you. And so there's no doubt that if you wear a mask, it is helpful in slowing the spread of the virus. We don't necessarily, cannot necessarily argue that a mandate itself causes the virus to slow down, because what matters is whether or not the people are actually adhering to whatever the rules that you put in place. It's not the words on the page, statewide mask mandate, which has become a buzzword now across the country. But if you'll recall, back in early March, the buzzword was ventilators, and then it was shelter in place, and then it was one after another after another. The reality is every leader of state and community should do whatever they believe is in the best interest of their citizens to get the most number of people to comply and to participate in the measures that actually work. And that's what we're trying to do in our state. We have seen it work, by the way. We took this exact same approach in June and July and August during our first spike. We went up to approximately 9,300 cases over a 7-day rolling average. And then we went county by county. We saw a significant decline down to about 3,000 cases over a 7-day period. And now we've turned that now, unfortunately, with winter approaching, that has turned around.
Shepard Smith here. Thanks for watching CNBC on YouTube.